All right, welcome to your first year at IMU. Look, you're stepping into the world of dentistry at a really exciting, kind of crazy time, a time of huge change, all driven by artificial intelligence. And that brings up a really big question, a fundamental one actually.
Seriously, think about that for a second. If a machine can do all of that, what are you doing here for the next 5 years? Now, the goal of this little explainer isn't to tell you to avoid AI. No way. The goal is to figure out how to master it, how to use it with real skill, with solid judgment, and most importantly, with integrity.
So yeah, let's reframe this whole thing. This isn't some kind of threat to your future career. It's basically a change in your job description as a student. Your job now isn't just about memorizing facts. It's about learning how to learn strategically, how to question everything, and how to build skills that, go way beyond what any algorithm can do.
Okay, so let's get into the practical stuff. How can you actually use this thing? The very first step is to see AI for what it is. It's an unbelievably powerful tool. But listen, it's not a shortcut to get out of learning. Think of it more like an accelerator, something that helps you deepen your understanding, but faster. Let's look at 4 really concrete ways you can do that right now.
So here we go, 4 ways to make AI work for you. First up, summarize. You got a super dense research paper on, say, new composite materials, feed it to an AI and get the main points in seconds. It's a game changer. Second, quiz yourself. You can ask it to generate a whole bunch of practice questions on the anatomy of the mandible right before a big test. Great for recall. Third, re-explain. When you're just not getting a concept like a really complex biological process, ask the AI to explain it to you like you're 5, or to use an analogy. It can be incredibly helpful. And finally, number 4, simulate. You can get it to create a realistic patient case study with a full medical history and symptoms so you can practice your diagnostic thinking.
I love this idea. It really captures the whole point. It's like having this study buddy who's ready to go at 2 in the morning, never gets tired, and you can ask it the same dumb question 10 times and it won't judge you. It's fantastic for building up that foundational knowledge and doing it efficiently. But, and this is a really, really big but, it is only a tool.
And that brings us to, honestly, the most important part of this whole conversation. We've talked about all the cool stuff AI can do. Now it's time to get really serious about what it can't do, because that's where the real value of your dental degree lies.
Look, awesome tech has been part of dental education for ages. It makes learning better, for sure, but it never replaces the core of what it means to be a dentist. Because for all its incredible power, AI is missing something essential, that human element.
So your next 5 years, they're all about building these 3 things that AI just can't touch. First, there's clinical judgment. This is about making tough calls, often under pressure with information that isn't perfect. Second is patient empathy. Actually connecting with a person who's scared or in pain, understanding them and earning their trust. And the third pillar is professional accountability. This means you take full responsibility for every decision you make and what happens because of it. You don't learn this stuff from a database. You build it day by day through real experience with real people.
And here's a huge reason why this is so critical. You have got to know about something called AI hallucination. Basically, it's when an AI just makes stuff up. And the scary part is it presents this false, nonsensical information with 100% confidence, like it's a fact. Why? Because its job is to sound convincing, not to be truthful. It literally does not know what it doesn't know. But you, as a future dentist, you absolutely must.
This really is the bottom line right here. When you graduate from IMU, that degree certifies your competence, not the competence of some chatbot or language model. Our accreditation standards are crystal clear about this. You are the one responsible. You can never, ever delegate your professional judgment to a machine.
Let's just break this down to make it super clear. AI is amazing at one thing, calculation. It can churn through mountains of data to spot patterns and guess what might happen next. It's all about probability. But human clinical judgment, that's a whole different ballgame. It's contextual. It takes into account the patient's whole life, not just the data points. It's ethical. You're weighing right and wrong, not just probabilities. And it's accountable. At the end of the day, you're the one who has to answer for the result. That's what makes you a professional, not just a data processor.
Okay, so that's the why. Now for the how. How do you actually put all this into practice in your day-to-day life as a student? What you need is a plan. A smart strategic framework for using AI without letting it get in the way of developing those core skills we just talked about.
The best way to think about this is to start thinking like a dentist right now. When a clinician designs a treatment plan, it's not random. It's intentional, it's structured, it has a very clear goal. You start with the goal, a healthy patient, and you work backward from there. We can take that same exact approach and apply it to how you plan your study week.
So here's a really practical model for you. Think about your study week in 3 distinct zones. In Zone 1, you've got your AI-assisted tasks. This is where you use it to do things like summarize your lecture notes or create flashcards. This zone is all about speed and efficiency, building that base knowledge. Then you move into Zone 2. This is for human-led tasks. This is where you turn the AI off. You focus on group discussions about clinical reasoning, you get into the sim lab to practice your hand skills, you reflect on tough ethical cases. This is for the deep learning AI can't help with. And finally, you have Zone 3 for integrated tasks. Here, you mix them. A great example? Have AI generate a really complex patient case, and then you get together with your study group and work through the diagnosis and treatment plan, and you challenge each other's ideas.
All right, we need to talk about something that sits underneath everything else we've covered, and that's integrity. And look, this isn't about me trying to scare you with a list of rules. This is about building the kind of professional character that is the absolute foundation of any career in healthcare.
So let's be super clear. There are 3 big principles here. 1, the work you hand in has to be a reflection of your ability and your effort. Copying and pasting from an AI, that's academic misconduct. Simple as that. 2, be transparent. If you're allowed to use AI for a certain task, be open and honest about how you used it. And 3, and this is probably the most important, when you put your name on something, you are taking 100% responsibility for everything in it. Its accuracy, its originality, all of it.
And this is why this is such a big deal. Integrity isn't just some university rule you have to follow to avoid getting into trouble. It's practice. It's the training ground for the trust that a patient will one day place in you. The habits you form right now, honesty, accountability, those are the exact same things that will make someone feel safe putting their health in your hands.
Okay, let's wrap this up. We're going to bring it full circle right back to that question from the beginning. With everything AI is capable of, what are you actually here to do?
So, what's your job? It's simple. Your job, your mission for these next 5 years, is to focus like a laser on developing everything that AI cannot do. Your goal isn't to be a walking textbook. It's to become a source of wisdom, of genuine care, and of unbreakable trust.
And these are the things you're here to build. Real judgment, especially when things aren't clear. Deep empathy for the human being sitting in your chair. Total accountability for every single thing you do. And of course, the incredible hands-on skill that it takes to actually heal someone.
This isn't something you put off until after you graduate. That work starts right now, today, in your first semester, with every choice you make. So go on, use the tools, get great with the technology, but never, ever forget that your real value, the thing that makes you indispensable, is your humanity. Go be the dentist that AI can never replace.